Health and Family Welfare Minister James Sangma today inaugurated the Biological Waste Management System, the PSA Oxygen Generating Plant and Bedded Geriatric Ward at the Civil Hospital, Shillong. The facilities were inaugurated in the presence of Principal Secretary Sampat Kumar, Secretary R.M. Kurba, DHS MI Dr. Amanwar, and other officials from the Health Department, the NHM, and Civil Hospital, Shillong. Speaking at the inauguration program, the Health Minister informed that the government will ensure such facilities will be replicated in other medical facilities across the state. He said that the COVID-19 pandemic was a rude awakening for the state, and with interventions, now the state is self-sufficient in oxygen supply. He also lauded Civil Hospital Shillong, stating that the hospital is setting the benchmark for other public sector hospitals in the state.
When we speak about the success of Shillong Civil Hospital, today you are setting such high standards and setting benchmarks, which is going to be very, very challenging for other district hospitals to follow. But these are standards very much required, and this is how we gauge and we measure our progress in our state. When we start thinking and caring about the elderly population or our children. And I'm very, very honored and pleased to be here today, where we are looking at inaugurating the geriatric ward along with the PSA oxygen plant and the waste management system. This is something that it shows really how progressive Meghalaya is becoming. It is an indication of that. It is a testimony of the kind of progress that we are seeing in our state. And this is a start, and this is something that we have to replicate in all other medical health facilities across the state. And it is the constant endeavor of our department to ensure that these services will be also put in other medical facilities across the state. And as I was saying, this is progress, and this is something that I'm extremely proud of. And today we are not inaugurating just one but 3 such interventions. COVID has been a rude awakening for everyone, but nonetheless an awakening, and it has made us sit up and look at very, very small things which we would have on our day-to-day lives missed out, like the PSA oxygen plant. And I'm happy that today Meghalaya as a state is extremely self-sufficient when it comes to oxygen supply in our medical facilities. And this plant is being inaugurated. It's just a formality. It has started functioning a long time back, and it has been functioning very successfully. And kudos to the medical staff, the surgeon superintendent of the hospital, along with all the other supporting doctors and the staff, for successfully implementing this and making sure that it runs in a proper manner.